with the United Securities, but as things have changed in the marketplace, it's gotten tougher and tougher to get things issued. United Securities takes a unique outlook at long-term care and gives us an avenue where we don't have much anymore with a lot of the long-term carriers. So it's been moved up in importance with us and with the field out there, and we wanted to make sure that you are aware of and understand what United Securities has to offer. Now, first and foremost, it's not in all of the states out there, and we will cover that at one point in this seminar where it is available, so keep that in mind. But we definitely wanted to bring it to your attention because it is an avenue where you may have some of the tougher cases to get issued, or even some things that you really thought should have been issued. We might have a place here with United Securities. Today I have Matt Sussman, the Director of New Business Development with United Securities. He's going to go through their product and their company, tell you a little bit about both, and hopefully there will be quite a bit of participation in this. Now, I have everyone muted at this point because when we do these webinars, we do get a lot of echoes and noises, so I've basically muted everybody. But if you did put in your PIN number at the end of the webinar, we will open it up for questions, and you will be able to ask questions at the end of the webinar. If you didn't put in that PIN number, then I won't be able to mute you, and you can also ask a question by typing it in. So with that, Matt, I'd like to introduce you and have you start off with the presentation.
Good morning, David, and thank you for the introduction. Good morning, everyone on the phone. We appreciate you taking the time this morning. We're here in Pennsylvania, and the temperature outside is 10 degrees, and with the wind chill, it's -5. So it's nice to bring the temperature up with this seminar a little bit this morning and get you real pumped up for putting more dollars back into your pocket with our underwriting ability. And what we're going to do today is we're going to kind of go over the products. We're going to talk a little bit about why United Securities Insurance, and then I'm going to turn it over to our underwriter, Deb Delp, who is actually our nurse underwriter, has an extensive background in a lot of areas. So we're going to really hone in on underwriting because that's really what we feel makes our company different from all the other carriers out in the industry. So let's kind of just take it and move it forward. And let's go why. So we talk about declines in the industry. I really like to show this slide here because it really tells and speaks to volumes of what's going on in the industry, especially as what David had mentioned. As you can see, those from the individual ages of 79 and below, there's approximately 25% decline rate in the industry, and I actually think that's getting a little bit higher just based on the last study that this came out in. But one of the things that we look at here is, what about those individuals that you could not even submit to the company because they told you they had MS or Parkinson's, or their height-weight ratios weren't good, or other comorbid conditions that the carrier said, sorry, we just cannot accept that. So what we're going to do today is give you the tools to be able to make you more money and help your clients at the same time. One of the things also I didn't include in this chart is ages over 80. There's a 70% decline rate for those individuals. We actually take individuals up to 85 years old on our LifeStyle Solutions and Select. So that's going to be another category that we're going to be able to help you out with. So I think we're one of the carriers that have the oldest age groups that we can continue to underwrite. So as we move forward, this is just kind of, hey, what can we do for you, the agent, at the same time helping your client? So this is just an example. I have new premium you sold is $150,000 for the year. The decline rate is 25%, so it's $37,500. That's additional premium issued is $22.50, and the additional premium issued, because we have about a 60% issue rate. So you take that additional premium and you times it by a commission. Well, I tell you what, that's nice gravy in your pocket. That's like, taking the jeans out of the wash, out of the dryer, and finding that $20 bill. That's what it's all about, being able to help those individuals and and really making a difference in what we do. So 5 reasons we want your business. Underwriting. As I mentioned, underwriting is really the major focus on why we can do what we do. We have a very flexible approach. In my opinion, we have the deepest underwriting breadth. With our lifestyle solutions, we have 4 underwriting categories as well as a total product on itself that will underwrite individuals with more severe health conditions. We also are unisex rates, so for your single females, that's really going to make a difference in today. We've talked about this. I know a lot of carriers have gone gender-based, but right now we're very comfortable in still offering the unisex rates. Approximately 60% issue rate on our LSS and Select plan, and we get a lot of declines from other carriers, and I think that's a really high issue rate because a lot of the individuals who are sending us the applications have already been declined. So if we can issue that, we're doing a good job. Our product is extremely comprehensive. Our lifestyle solutions have some things that not really any other carrier has in it, and we'll talk about that. Obviously, we feel we have an expert staff in the home office. We've been doing this since 1983, so we kind of know what we're doing here. And the last is really, with someone who has MS or Parkinson's, there are no other carriers in the industry that will consider someone with those health conditions. We will. And we'll talk a little bit about how we can do that. But for some people, we are the only option if they want a true long-term care insurance policy. So the product availability, as you can see, I'm going to leave this chart up for a little bit. We're in 26 states currently.
And Matt,
and we have various products.
Yeah, Matt, if I may jump right in there.
Sure.
You know, like I said, starting this webinar, is we've worked with United Securities for several years now. Primarily, we've been using them in Washington and Nebraska and in Texas. But recently, and this is what really has caused us to jump out and let people know more about that, is the addition of some additional states that we had in our territory that we work. Colorado being one of them, and I think it was, what was the other one? Arizona, was it, that just jumped on. So we are very, very excited to be able to bring this opportunity to everyone out there. As you look at this map and see if you're attending this, you see it in one of those states, it just opens up more opportunities for you to get additional sales. Go ahead, Matt.
Great, thanks, David. This is a very complicated chart that I'm going to make real simple for you. These are all the states that we have available. And if you go across, let's just look at Arizona, the different product lines that we have. We have a long-term care product line, which is one of our older generations of product line. It's a non-tax qualified product line. And then in several states, we have a standalone home health care product line. And then we have our tax qualified product lines. And the LSS 14 is our lifestyle solutions, which we're going to talk about today. And our LS14-SL is the lifestyle solutions select, which we're also going to talk about. Next column you can see is whether the product is partnership approved or not. And then we also have a short-term home health care product. We're not going to get into too much of that today. We're going to really focus on those key products that David had mentioned, us being now in Arizona and Colorado. And then we do have some life products still available, but not really that competitive in the market with the life at this point. So if anyone would like a copy of this, we can certainly get this to you through David. And it's really something that I keep on my desk because we deal in so many different states. And with the ability now to do sales over the telephone through the internet, we have a lot of agents who once did sales just in their state, but now are doing sales in multiple states. So let's dive right into the product line here, the lifestyle solutions. This product line is a great, great product line because it's really going to help those individuals in caring for them and making sure that they're getting the right level of care. So our daily benefit here is $50 to $350 per day. When it comes to home health care, we do look at this on a monthly benefit. So if you have $150 a day, it's $4,500 in that given month for it. Our maximum benefit periods are 1 to 5 years, and in some states we actually still do have a lifetime plan available. But we don't really see that often. I know lifetime was huge many years ago. We're seeing 3 and 5 being really the average in our company right now. The elimination periods, as you can see, are 40, 90, 120, or 180 calendar days. And I think it's important to know how we look at our calendar days. The way we look at our calendar days is that individual must be responsible for payment to start the clock ticking. So they come home from the hospital and their family member is taking care of them. They call us 90 days later and say, all right, I met my elimination period. I'm ready to receive benefits. And we'll say, sorry, you were not responsible for 1 day of payment, therefore you didn't meet your elimination period. So it's really critical is that when they need care, they have to at least pay for 1 day of care. That will start the clock ticking, and that will start with the elimination period. When it comes to Medicare and Medicare supplements, the way we look at that is if the individual is admitted in the hospital for 3 overnights and Medicare is paying for the next 20 days in that skilled nursing facility, their Medicare supplement is picking up the deductible for the next 80 days, encompassing 100 days, we will also consider that as satisfying their elimination period. So if they, after the 100 days, we will pay as long as they met the elimination period if they have a 90-day elimination period. So that's really important. Our calendar day elimination period is a little different. Home care and adult daycare services, we're going to pay it 100%. Our issue ages, 40 to 85 years old. Now a lot of individuals, carriers still have that up to age 85, so that's another sweet spot that we have that we see advantage of with these product lines. We have other product lines that go up to actually 99 years old. I think the oldest individual we underwrote was about 97 years old, which was really kind of cool. Products do have waiver premium built in, and as I mentioned previously on the chart, they are partnership where applicable. Just to kind of make some notes, in Arizona did not approve the 1-year benefit, so in Arizona it's a 2, 3, 4, and 5-year benefit. So that's just kind of the keynote. And there's Maryland also did not approve. I know we're not have a lot of individuals on Maryland, but wanted to point that out. So it is a total pool of money plan, which means if you don't use the full $150 a day or $4,500 a month, that money stays in the pool, so the plan lasts longer. We have 4 risk classes, and these risk classes we use all the time: preferred, standard, class 1, and class 2. What we typically see from previously declined cases is that class 1 and class 2 are the most widely used underwriting categories. About 57% of that is actually class 1 and class 2. So I think that's really great. A lot of people think just because that they've been declined by another carrier, they have to go into our impaired risk product, and that is not the truth by any manner. So it's really great that we can offer full coverage with no limitations, or very little limitations, I should say, to someone who's really looking for coverage. The discounts, a little bit different here. We do offer a 15% discount for those individuals who are married or same-sex partners sharing bills for at least 12 months. And if both of the spouses or partners take a policy with us, it's going to be a 20% discount. So we do incentivize those individuals to keep both spouses with the same carrier. Inflation factors, I think it's pretty evident in the industry today. 3% is the new 5%. So we do have the 3% simple, 3% compound, as well as the 5% simple and the 5% compound. What we're seeing most often, obviously, is the 3%. So that's kind of our LSS, very similar to the other products that you're selling out there, with a little kind of nuances that we'll talk about, including the service program, and we'll get to that in a little bit. I always like to show some case examples that we've been able to underwrite, and Deb certainly will go into this much further. But let's take a look at the first profile. A 64-year-old female, 5'3", 165 pounds, has some anxiety with stress, panic attacks, one medication, but it's not an antipsychotic medication. We do not look at antipsychotic medications. Slight urinary incontinence, applied and approved at a standard underwriting class for us. Second profile is a 65-year-old male, 5'10", 187 pounds, MVA with head injury, triple D, which is degenerative disc disease with spinal stenosis, some alcohol abuse 4 years, and he's been sober for that time, so that really plays a lot of effect into how we look at that individual. And we did receive a letter from the physician stating the sobriety, which is important. Deb actually has a background in addiction, so with her skill set, we really have been able to do a lot better underwriting with some of these tougher cases. Normal LFTs since release from the rehab, and that's liver functions that we're talking about. So applied and was approved at a Class 1 underwriting. The third is a 65-year-old male, 5'3", 185 pounds, diabetes controlled, A1C is 6.5, hypertension, obstructive sleep apnea, blood pressure with history of TERP, and anemia and fatigue. We approved that individual as a Class 2. So that kind of gives you a range of what kind of individuals that we will consider under the LifeStyle solutions. Now let's take a look at our impaired risk product, the LifeStyle Solutions Select. And I call this the product of last resort. The way we can offer this product is there's some limitations to this. One of the limitations is that, and we'll go over them, but right off the bat is there's going to be some limitations in home health care. There's going to be some pre-X conditions, and the premium you're going to see is also going to be another factor in how we can overcome those conditions and still feel comfortable at the company offering it. So the maximum daily benefit, again, this is a monthly benefit for home care, is $50 to $150 a day. So the max is $4,500 a month. The elimination periods are going to be 90, 120, or 180 calendar days. They work exactly the same as the LifeStyle Solutions. Depending on the plan that you choose, it's going to kind of determine which elimination period you do. So the home health care benefit, this is one of the limitations which protects the company, is 50% of the maximum daily benefit. So we'll offer up to $75 per day for home health care. Issue ages are the same, 40 to 85 years old. Now the three options that we have available, option A is not available in Arizona or Maryland, but it is a one-year plan with one of the three elimination periods. Option B, which is a 2-year plan with either a 120 or a 180-day elimination period. Option B is our most widely selected plan for the LifeStyle Solutions Select with a 120-day elimination period if the underwriting will allow it. The 120-day, there's not really a big price difference between the 120-day EP and the 180-day EP, so I recommend every time go with the 120 EP if it's allowed. And the option C is a 3-year plan with the 180-day elimination period. It is that same pool of money, so if you don't utilize that whole benefit, it does carry on for the policy to continue. The available discounts here are a little bit unique, is that we will offer a 10% discount if they're married or same-sex partner for the LifeStyle Solutions Select. If both spouses happen to fall in the LifeStyle Solutions Select, we're only going to give a 10% discount. If one of the spouses is in our LifeStyle Solutions and one of the spouses is in the Select, we will give the Select individual a 10% discount, and we will give the Solution spouse the 20% discount. So again, a little bit more incentive to keep those individuals with the same carrier. Inflation factors are identical at 3% and 5%. The other thing that makes us a little different is the pre-existing condition period. there's a 6-month pre-X condition period. And really what this means is that for the first 6 months that the policy is in force, if the client needs to go on claim for any pre-X condition, we will not cover it. So let's make it real simple. They are approved in January, and in April, they file for claim because of pre-X condition. We are not paying that condition. We're not going to wait till the 6 months to pay that condition. We just will not pay that condition. Same scenario, January approved. In July, calls us up and says, hey, I need a little bit of care for a pre-X condition. They met the 6-month pre-X, and we will pay for that claim as long as it's a legitimate approved claim. So we do sometimes get a lot of confusion on how that works, but that's just simply a time period from the date of purchase or date of approval of the policy. Now, we don't see a lot of quick hits, but that's one way that we avoid that within this policy. And it is partnership approved in the states, as I had mentioned. Let's look at 3 scenarios for the Lifestyle Solutions Select. We have a 66-year-old female, 5'3", 163 pounds, irregular heartbeat, smoker, 1 pack for 35 years. Had some COPD, emphysema, 207 chemotherapy, but it was in remission. Chronic non-alcoholic fatty liver, arthritis, anxiety, insomnia. So they applied for the LSS Select with a 90-day EP, but they were approved with a Select on a 120-day EP. And our philosophy is based on underwriting philosophy is based on a health and lifestyle approach. So just because we can't accept them or have a comfort level with exactly what we want, we're going to try to find ways that we're comfortable in offering them coverage, but making the risk a little bit snugger for the company. So that's why in this case we offered a longer elimination period. Second profile is we have a 65-year-old female, 5'6", 220 pounds, have some hypertension, uncontrolled blood pressure readings, history of breast cancer with metastatic to the lung, metastasized into the lung, not so great, but spinal stenosis, lumbar spine, we've got a lot going on here, arthritis, COPD, ocular migraines, depression, anxiety. They applied for a standard underwriting, so I'm assuming that the agent probably didn't do as good a job as they could on qualifying this individual, but we approved them with a Lifestyle Solutions Select. All good cases for us. 64-year-old male, 5'10", 260, diabetic, some diabetic neuropathy, obstructive sleep apnea, coronary artery disease, quad bypass, smokes cigars 1 time a week. Everyone has to have their fix. Depressions, chronic back pain with hernia, history of testicular cancer. Applied for a Class 2, approved in an LSS Select. So those are just, again, 3 examples of some of the conditions, comorbid conditions that we can look at comfortably under the Lifestyle Solutions Select. And again, the way we can do this is we saw some of the limitations. Premium-wise, it's about 300% more expensive than our standard underwriting class. So with the limitations, with the increased premium, we're very comfortable with this product line. It is profitable for us, which is certainly good, because if it wasn't, we would be pulling it off quicker than we could blink an eye. So really great about this. Yeah, now, what you're looking at now, I'm going to give you just a sec to kind of glance over it.
Matt, just a comment here is, you know, if you have the people that are attending this webinar, again, this is David Wayne for people that showed up late, but if you have written any long-term care, you all are sitting out there watching this webinar, and if you've written any long-term care, you know those examples that Matt showed you, that you probably have run across some of these type of cases. This is why we're bringing this to your attention today, is that it's just not going to be a case that's going to get issued out there with a lot of the carriers that we bring to you. And we need options like this because even though we're seeing people living longer, doesn't mean they're living any healthier. So we do definitely need to find an answer for these types of people that have these types of conditions, and United Security has stepped up to the plate to give you an option to move forward and not to have to say, sorry, I can't help you. Go ahead, Matt.
Great, thank you. Such a good point. What we're looking at right now is something that I keep on my wall because it just really differentiates quick between the two product lines, the Lifestyle Solutions and the Lifestyle Solutions Select. On the right-hand side, you'll see the Lifestyle Solutions Select, which is paired on the left side, the Solutions. Some of the benefits I didn't even talk about, such as alternative plan of care, bed reservation, you can see that are built in. Under the bottom, second to the bottom, you have your Coventry service programs, which I'll talk about in a minute, which are built into both the policies. So this is really just kind of, hey, if I'm not dealing with the company every day, every week, every month, this is something that you can just pull out and say, hey, these are the differences. But it's really going to be dictated by underwriting on what plan that you go, whether it's a Lifestyle Solutions or a Select. And again, if anyone would like this, please just ask David. He'll be glad to send it out to you. So let's talk about the service program and why it's such a great part of what we do here. So the service program was developed with the Johns Hopkins Geriatrics. And what it's really designed to do is help somebody, the wellness program is designed to help somebody stay at home for a longer period of time. I know I have Capital Blue Cross here in Pennsylvania, and both my boys have asthma. And once or every other month, I'm getting a call from Capital saying, oh, Mr. Sussman, we have some great plans and some educational pieces on asthmatics. Would you like us to send it to you? Well, we work with the Children's Hospital, so we're comfortable in our kids' asthma. But what they're really trying to do is help us keep our kids from having that asthma attack and going into the hospital because of it. So it's really the same theory here. Is what we're trying to do with the wellness program is really keep that individual healthier for a longer period of time. And it's really a benefit, one, to the client because no one wants to need care or be unsafe, and two, it's a benefit to the company because it helps us keep that individual healthier longer. So it's really crafting a collaborative overview of strengths and challenges within the member to make sure that they're doing the right thing. There's a free consultation or referral program which is offering help and resources. So let's say the individual needs a roofer, okay? Believe it or not, they can call United Security Assurance and we'll make a recommendation for a roofer. Now, one of the reasons we have the referral program in place is because it's been proven that there is elder abuse out there. I think that can't be challenged. But if we do a lot of vetting from these vendors, and we will find vendors that will meet our criteria. Now, we're certainly not going to pay for them, but we do have it available for those individuals. And this is all free, part of being in the program. So once the policy member is in force for 60 days, we're actually going to get a letter stating and telling them about our wellness program. And we also have, when it comes time to claim, we also have the care coordination or the care planning, helping that individual really make it easier in a very stressful time. So why is the service program an asset for LSS? It's available before a member even makes a claim, which is great. So there's actually benefits in this policy before they go on claim, and they can have a wellness program every year, once a year. And it's a proactive approach to promote positive aging through the focus of wellness planning. So with the wellness planning, what I like about it is we're going to send them letters, okay? First, we're going to send them an introductory letter. Hey, are you interested in participating in the wellness program? If they say yes, we're going to send them some more vetting letters trying to find out what they're looking to try to work on. But what I think is really cool is that once we get these vetting letters, we're actually going to send someone out to the house for them to do a home safety test and a physical readiness test. And why do I think this is important? Because we've all been in the homes where we're not really sure where we want to sit in that home or if we even want to sit down in that home. Well, if we get out to that home and that individual, we'll call it, consider it a hoarder, that might be one reason that that individual really wants to work on some of his depression issues. That makes perfect sense why he has depression. Or maybe we're out back in the home and we find out that this person, because of everything going on, has some depression that we notice, and we're going to be able to help them out. Also, with the safety check, do they have smoke detectors? Do they have fire extinguishers? Do they have carpets on the floor or rugs on the floor that are probably not safe because we were looking at that rug and we see, the corner of that rug seems to have that perfect stance of always being up. That might be a good sign that they're tripping on that often, and that might be a danger to them. So obviously they've already been underwriting, they already are a policyholder, so someone coming out to the house is not changing anything of their status. It's just making sure it's safe and they're getting exactly what they need. So I think that's really neat to have in a policy, especially it's a free service that can be utilized after 60 days the policy is in force. Okay, so why LSS and Select in an overview? There's 4 underwriting classes to issue more of your business. Successful in offering coverage to those individuals have been declined from other carriers with approximate 60% issue rate. Do you have those clients with MS, Parkinson's, or diabetics with higher uses of insulin? We have that impaired risk plan that can help you. Issue ages up to age 85. We offer unisex rates, which the single females will really make a difference. And that built-in wellness program designed in collaboration with the Johns Hopkins Geriatrics, which can be utilized prior to being on claim. So they're actually getting something for the policy before going on claim, which is really great. So at this time, I think we want to get to the nuts and bolts on why you guys are going to send us business. So at this time, I'm going to turn it over to Deb Delp, our nurse underwriter, and she's going to talk in depth about our underwriting. Now, we usually get a lot of questions during the underwriting session, and because this is a muted session, I'd like everyone just to write down their questions so they don't forget to ask Deb or myself, because this is a really great time for you to understand more about the company and figure out which client is going to benefit from us, which you might have called them before, you couldn't help them, but now you can go back and say, hey, I have an option for you. So without further ado, I'm going to turn it over to Deb.
Good morning. I wanted to go over some of the points on why we can do what we do. We do have, as it says up there, a lot of combined experience in underwriting claims and with the agency. But we also, what I like to stress is we have not only a common sense approach to underwriting, we have an all-inclusive approach to underwriting. And by that I mean we don't just look at just the medical records. We look at their lifestyle choices. We look at how active they are and things like that. We also look at the combination of comorbid conditions, how they interact with each other. In addition to that, we use counteroffers a lot of the times just to make it work. If we can extend the EP, possibly do a Class 2 with a longer EP rather than going to Select, or if the person is definitely medically compromised, whether we can offer them a higher elimination period and we can offer them Select as well. I want to go into, we do take cases, as Matt said, we do take cases that a lot of times other insurance companies will not take. We also take cases that have been declined. We do like to hear what the declination reason was from the other company. If you should have a letter, that also helps us to factor that in. But when we take things like Matt said, we do take Parkinson's. We do take diabetics that have controlled diabetes. We do take MS. When we look at these cases, yeah, go ahead. When we look at these cases, some of the questions that we would like you to be asking, what are they being treated for? First thing I ask is, height and weight and age and the state that they're coming from, so we know automatically what we can do for them as far as state guidelines. But what medical conditions do they have? If so, what is that condition and who is treating that condition? Also, how often, when was the last time you saw your doctor? Is your condition stable or unstable? If you've had, for example, if you've had back surgery, how recently was it? Have you gone through PT? Have you been discharged from PT? Some of the other questions to go along with that would be, have you been discharged to resume normal activities? What medications they're on, what medications they're taking, and in many cases they'll give you the medication, but they really have no idea why they're taking the medication. Or agents may start off by giving me medications and I kind of work backwards to get the diagnosis from there. Have you had any medication changes? In many cases you might have hypertension where they may have changed that hypertension med, they may have removed a med, they may have actually substituted a medication, and we like a little bit of stability to see how they are adjusting to that medication change. Do you see any specialists? If so, why do you see a specialist? If you see an orthopedic surgeon, did you have a surgeon recently? Do you have osteoporosis? A lot of these things factor in. Any limitations in daily activities? For example, if the person has RA, rheumatoid arthritis, some of the questions I like to ask agents to find out, can they zipper? Can they button? Can they open jars? What is their dexterity like? Obviously, visually, you can look at their hands to see if they have any nodules or if they have any limitations. A lot can be done by you through observation. Do you need any assisted devices to walk? Do you need a cane when you go outside on an uneven surface, or if you're going outside in inclement weather? Do you like to use anything to give you any kind of assistance for stability? Do you use a walker? If so, how often? I've had people tell me, well, you know, I use those carts at the grocery store, but I don't use anything at home. Obviously, height and weight. If the person is, let's say, vertically challenged and they give you their weight, they're only kidding themselves, because the first thing we do is we look at the height and weight in the records. And a lot of times they'll tell us they're 5'8", when actually they're 5'4", and their weight class is not going to meet guidelines. So that's important. Our guidelines on weight, in my opinion, from the nursing standpoint, are pretty liberal, so we do not waver on weight guidelines, just to let you know. The first thing I say is, if you are close to our maximum guideline limit, I'm going to send out a face-to-face nurse with a scale in tow. Okay, so do you have any significant illnesses such as cancer, heart disease, diabetes, or any recent hospitalizations? So we do need to know that as well. We do need a period of stability if they've had anything going on, so that would be determined. We can give you questions to ask. Another thing I wanted to mention was, a lot of times agents will call and they have a condition they're not aware of. They're not aware of what exactly that condition is, therefore they're not aware of what exactly to ask. We'd be happy to give you the questions, especially if you're going out on a call in the evening when underwriting is not there. I would be happy to give you those answers. If you're unable to make the call or you're busy, you can certainly email us at any time, and we'll be glad to get back to you. I'm pretty quick about getting back, as was everyone else in the department.
Just to interrupt, I have what we see as a pre-qualification form, as Deb had just mentioned, that you can send us an email all the time. This is a really great form that we've developed that will really help you ask those questions as well. And this can be emailed. It can be email right from our site, or we could have David send this out to everyone to help them out. But to ask is all the real key things that Deb just mentioned: the state, the age, the height and weight, the gender. Are they tobacco use or not? And Deb's going to talk a little bit about Colorado, because it's a little different, and the recent changes with marijuana out there and how it's looked upon. But with this, your medication, your dosage, the condition. If they have cancer, well, when was it diagnosed? What's the treatment? When was the last treatment? Diabetics, are they insulin dependent or not? If they are, how many units? What's their A1C? That A1C really tells us a lot, and it's very important that we know that. Are there any complications with the diabetes? And the biggest thing that we see is, you know, we ask the client, do you have any neuropathy? And the client says, absolutely no. I don't have any neuropathy. And then we ask the question, do you have any numbness or tingling in your toes? Oh, yeah, I have that. Well, you know, it's tomato, tomato. It's the same thing, just asked a different way. And that's what we're really trying to help agents understand, is that, you know, they might not know the technical name for what they have, but they know the feeling. So That's why, if we can ask these questions in a different fashion, it will only benefit you, the agent, up front. And then we have some of the major conditions, the heart diseases. Did they have a bypass? Did they have any stents? Did they have a pacemaker or a defib? And then any other questions, any information that we need to know, and conditions that we don't know about, any hospitalizations or surgeries, and if they were previously declined, telling us why they were declined also helps a lot. Our idea is to really give you the best pre-qualification decision up front. And I can tell you, when I started with United Security Insurance back in 2009, and I would talk to Jennifer, I'd say, Jennifer, who's one of our head underwriters, I said, Jen, here's what the client looks like. She says, man, I can't give you an answer. I said, what do you mean? She says, I can't give you the pre-qualification. I don't have enough information. And I was really starting to get a little aggravated with Jen, saying, well, why can't you give me something? But over the years, what I've learned is Jen taught me to become a better underwriter, field underwriter. And when I have a client, I talk with them, I ask them all these questions, and I got to tell you, 95% of the time, as long as there's no mystery when we get the medical records, that pre-qualification is going to hold true because of the questions that Jen and now Deb has asked us, the agent, to get. Because if we go out there and we quote them a standard, but if we had more information, we would quote them a class 2, we probably would have a better chance of getting that sale on the first shot. Because now we have to go back. They got approved, but it was a counteroffer. Now it's more expensive. Maybe we have to limit some of the benefits, and definitely increase the premium. So it's really key, and I think that's one of the biggest problems we see in the industry today is underwriting and declines. And if we can become better field underwriters as a whole, I think it'll make it easier out there on which company to go to first for the declines. So let me just kind of swing it back to there. Back to you. Sorry about that.
Okay. As far as the underwriting process goes, the phone history interview we like to do hopefully within 48 hours of the time we receive the application. The person that does the phone history interview actually sits next to me. She's very leading with questions. She's very encouraging. And we also do a cognitive screening. Usually you can tell by how the person's handling giving the factual information if they're going to do well in the cognitive screening. We don't have a difficult test, but we have one that will tell us whether there is a red flag or not. Medical records are usually requested, honestly, on most of our applicants, I would say. As you can see, it's over the age of 80, if they've been previously declined, and if they're applying for 5 years or more of insurance, I can say without a doubt on all diabetics we get medical records. It's pretty much up to our discretion. Rarely do we waive that. We usually do get records to read. Maybe not from everyone, but usually from at least the primary. A face-to-face assessment. Since I've come, I think we have not done these as much because we weren't getting the information that we needed. Basically, we feel that if there's a question at all, we will, up to underwriter's discretion, go ahead and get a face-to-face. But be prepared if we feel there's some red flags that we're seeing on the records that we want the nurse's actual, eyeballing the patient to take a look at them to get one. Some of the pre-qual misses. If there are diabetic complications, as Matt said, I think terminology has a lot to do with things. And when you can ask leading questions such as, I know, for example, my sister-in-law has diabetes, her feet bother her at night, she describes the following things, have you ever experienced that? Sometimes it's the way you word the questions, and I like to talk about that a lot because I think there are leading questions for you to gain information without using medical terms that put them off. Do you ever have any trouble with your kidneys? Do you go to an eye doctor? Do you ever have any trouble with your eyes? And they're all the 3 things we're really looking for. Do you know what an A1C is, and do you go? If someone's been a diabetic for years, they probably do know what an A1C is. But if they've been a diabetic for less than 6 months, they're probably not going to know. You can ask them, however, do you ever check your own blood sugar? Oh, you checked it this morning, and what was it? And you checked it before you ate. If you give me a couple fasting blood sugars, I can automatically convert to what that A1C would probably be. Have they had any surgeries or recent hospitalizations or any ER visits? Those are important. If they've had a colostomy or something minor, that's not what we're looking for. We're looking for something more than that. And obviously, back to, do they use any assistance in walking, any braces, any special shoes, the need for a cane? Is it a straight cane, or is it a more elaborate cane? Obviously, if you see them using oxygen, that would be no. Although, if people are using a CPAP or a BiPAP for obstructive sleep apnea, that is permitted and encouraged, actually. Pain management. Do they go for injections? Do they go for Synvis? Do they get the cushioning injection? Do they get pain injections? Do they get trigger point injections? We do not take implants as far as that goes for pain. But get a little more information on the pain management if you can, and how often they go. We do take, on select, we do take narcotics use if it is not an excessive use and if it is within the recommended therapeutic required doses. I also want to point out that you might want to obtain, if you don't have one, the knockout medication list. That can save you a lot of trouble if the patient is on a medication. We had one today where the agent gave the underwriter next to me 17 medications, and the 18th medication was a fentanyl patch. Okay, we do not take a fentanyl patch. So if you see things like OxyContin or fentanyl or something, you know, more than what's on our list, we will not take that. So that list will be very helpful to you.
Now, my head's spinning. Everything she just said. It's a lot of information, and we don't expect you to get it all. But what we do expect is, if you don't understand it, call the underwriters, because Deb will say, all right, this is the condition. These are the things that I need to know about these conditions in order for me to give you a really good pre-qualification. So you might get a little preliminary information about the client, and you'll have to go back to the client to get a little bit more information. Again, it's really beneficial to everyone, the better the pre-qualification is. So as long as you can get the major issues out, we're going to really kind of lead you in the directions of the additional information that we need. And I got to tell you, we do like phone calls. You know, you can speak to any of the underwriters regarding a case, which is great. And it's really, again, just beneficial. We want to be able to issue your business, but it's got to be good business. And if we can get a lot of those questions answered up front with a lot of certainty, bearing there's no mystery in the medical records, or there's information that we are not aware of because the client didn't tell you, which is very significant when you go to write the application. We do a very outstanding job on giving those pre-qualification decisions.
Okay, to accent some of our underwriting sweet spots, this is really important to me, and I think what Matt just said is really should be in here is we're accessible. You can call us, you can email us. I actually like to answer the phone. I find it challenging, especially with difficult cases or with unusual diagnoses, that I can actually help you. Coming from the nursing standpoint, believe it or not, I really do want to help you, and if within guidelines we can go ahead and issue something, that's really my goal. Some of the sweet spots that I know, having talked to many other writers and gone to different conferences, is we do take diabetics with complications and history of stroke, provided there's no residual. We do take diabetics with coronary artery disease or heart disease complications. We will give you a lot of questions to ask about that. We will review the medical, but we do consider them. History of strokes or TIAs. As long as there are no residuals, these persons can do all their own ADLs. Rheumatoid arthritis. If they are uncontrolled and they have full range of motion, and as I said, the zippering, the buttoning, opening jars, that gives you some indication when you ask those types of questions how they really are dealing with it. They can be on immunological medications. They can also be on steroids. If they are on steroids, that obviously will put them into select, but we do take patients with that. Multiple sclerosis, Parkinson's, as I mentioned before, with minimal symptoms. They're not in multiple sclerosis. Make sure they're not in the midst of a flare. As long as they are stabilized, and again, do all their own ADLs. Multiple and combinations of cardiovascular disease. We do take AFib, history of stroke or heart attack, There are some guidelines there, but we do take it. CHF, it depends on their ejection fraction and some of their test results. Coronary artery disease and so forth. We do take current tobacco use. We do factor that in. We do not have a specific class or consideration for tobacco users, but we do factor that in when looking at things such as COPD and tobacco use. Will put them automatically in a select. We will also look into whether or not they see a pulmonologist, and we also want to know, can you walk up and down the stairs? Can you go and walk at least a block and so forth? So we'll definitely look into the records, and we'll definitely look at that and talk to the person on the phone history interview. I want to touch on, as Matt just said, some of my nursing background is addictions and psych, so this was important to me to be a part of this, to write the underwriting policy that we now have for United Security regarding marijuana for the states that now have it legalized. And that is this. We look at it from two standpoints. We look at it from medical marijuana and recreational marijuana. These are the guidelines that we have for medical marijuana. It must be in a state where it is legal. The person must have a script for it. There has to be determination of a diagnosed disease and or illness for which he or she is using it. The applicant must admit to it on the PHI or it's an automatic decline. So you must tell us up front. The person using the marijuana is using it within therapeutic limits or as prescribed. This is important because most responsible physicians that are issuing medical marijuana will do random UDSs, urine drug screens, or do some kind of testing to make sure the person is using it within the limits. If the person is found to be non-compliant, referring to this, they will not be considered. In other words, if they're using to excess, they may have a script where they're actually overusing. Keeping in mind, we do not have a smoker's rate. We will and do factor in smoking either cigarettes and or marijuana with various conditions, such as the obvious asthma, COPD, and so forth, when we're determining rate class. I just want to point out that the cannabinoids in a compound in cannabis that has medical effects but does not make people feel stoned. There's a lot of misconception out there and can actually counter the psychoactive effects of the THC. So after decades where we had it in the 60s, when we were all, the flower child and the love theme, back then only the high THC cannabis was available. But now we've enriched these strains and they've been grown for medical users. Now let's talk about recreational marijuana for a minute. We do accept it and consider it in states where it's legal. We accept it and consider it only on a case-by-case basis, provided the individual has not and is not suffering any negative consequences from using. Negative consequences can take in medical ramifications, possibly legal ramifications. Here are some of the questions that I would ask you to consider if the applicant is honest up front in regard to marijuana usage. The following questions. When did you begin using? How much do you use? How often do you use? How do you ingest the marijuana? Can be smoking, can be eating. Have you ever been told to curb your usage or stop using? Does your doctor run random UDSs, urine drug screens, or test you in any way? This is to make sure, again, they're using within therapeutic guidelines. Have you ever been told you were within the prescribed limits after these testing? And have you ever, again, suffered any negative consequences from using? These would be recommended questions for those that are using and admit to using marijuana. Okay, top reasons for decline. Right off the bat, any memory or cognitive issues. We actually cannot take those at all. Any uncontrolled diabetes where they also have multiple complications, complicating the condition of the patient and compromising them further. Any advanced stage disease that are affecting the ADLs or their IADLs. There are some conditions where it is a demise, it's an automatic demise, and this person has reached a stage where the next phase would be to lose the ability to perform these We do not take that. If there's any pending surgeries coming up, the person says, oh, I have my knee replacement. Are you going to have the other one done? Yeah, but I'm not quite sure when. And when the medical records come, they're having it done in the summer because they're a teacher. So you have to be careful and be mindful of that. Noncompliance. Noncompliance with recommended treatment that's necessary. Noncompliance with medication where it is more of a life-threatening situation. And I would also say one of the other top declines is it's the height, weight not being within the guidelines. So that would be the main reasons for decline.
Well, good. Thanks, Deb. I know we're running low on time, so let's just kind of move it along. Some of the tips for doing business with us, we do really require 2 months premium with the application plus a one-time $25 application fee. If the client is declined or chooses not to accept the policy, we do refund the 2-month premium and the $25 application fee. We do need the original application, so once you get the signature, please send it in with the original paperwork. On the LSS and Select, we do offer credit card, Visa, MasterCard, or Discover for premium payments. Now what's nice about this is that if you're going to use the credit card, you don't have to get the 2 months premium or the $25 application fee. Once the policy is issued, what will happen is we'll send out the delivery sheet. Once we receive the delivery sheet back, then we will debit the credit card at that time. So they will not be debited until the policy is issued, approved, and we do receive the delivery sheet. One of the things that we see a lot, unfortunately, is when the applications come in, there's no risk classification. So it's really a time-consuming effort on the underwriters to try to mimic how that individual got the premium. So just please remember to fill out that complete application and make sure that you check what underwriting class it is. How do you access us materials? Once you get appointed and also going through David, you can find all the materials on our website, or if you call our office as well, you can do that. Software, once you are appointed with us, we will have software for you to download from the website, or the LSS and Select can also be found on StratDecisions as well. And if you need to call the marketing department or you need to call underwriting, what you have right up here is a list of everyone in our underwriting department who can take your calls and answer, and also our underwriting department as well. And if you'd like a copy of this, we can have David send that out to you as well. And that looks like it's it. So we want to thank you for your time this morning. I know we're going to open up the call for business, open up the phone call for questions, but I'm really positive, and I know that by utilizing United Security Insurance, we're going to be able to offer coverage to more of your clients who were previously declined, and at the same time put more money back into your pockets. And it's a win-win for everyone. So thanks again. We look forward to your questions. David?
Phew, that was a long one, guys, but you know what? It was a good one, and I'm glad that we took the time to do this. I want to thank both Matt and Deb for taking their time in doing this. It was great information. And one comment before I open up the phones, and that is simply, like I stated earlier, is we've worked with United Securities for several years now. And the people that have done business with us through them, the constant remarks I get is how friendly and easy to work with United Security it is. So I want you to give it a shot. Get contracted with them. There's a lot of avenues that you can work with them. You will find that they're very responsive. They're very helpful. They're very friendly to work with. You'll enjoy doing business with them. Now, as I open up the phones, there are some questions that got asked, and Deb, this one's going to be for you. It is a question from one of the agents that says, will either of the products look at a 60-year-old woman who has liver cirrhosis? She went through treatment last in May of 2012. She has been sober since.
She's been sober since 2012?
That's what it states, yes.
Okay. Actually, it would depend on her liver function test. If she's had recent liver function tests and her LFTs look good, LFTs meaning her AST, her ALT, and her BUN is specifically what we would be looking for. She's working a program to maintain her sobriety of some type of her choice, then we probably would consider her.
Okay. So hopefully the person that asked that is listening and can answer. Now, I am unmuting the phone, so there's going to be some background noise. Remember, we're unmuting the phone. Another question was, is it approved in California, which I know the answer to that is no. But the next question was, when will it be? Matt, can you answer anything like that?
Yeah, sounds like we have a little disturbance on the phone, but California is a tough state. I don't see California being anytime soon. When I say soon, within the next year or 2 years. And we looked at California, we agreed to move forward, and then we pulled back based on some of the guidelines when they made those changes. I think it was last year or the year before. So definitely a state that we'd like to get into, but we're just waiting a little bit longer.
I also saw Oregon. The same thing goes. It's not approved in Oregon, but you know what? If you're sitting in Oregon, Washington's right on the border. It certainly can do an app. And I wanted to ask, Matt, do you have a fillable app, or do they just have to mail the app and then have it mailed back to them and send it in?
Yeah, what we have a lot of agents do is they take the application over the phone, let's say, and then just send us the signature pages, mail the signature pages, and then mail back the signature pages. We don't have a fillable form right now that could be done.
Okay. Is it approved in Nevada, Matt?
It's not.
Okay. So those are the written questions that I had. The phones are unmuted. There are like 3 or 4 people that I haven't been able to unmute because they probably didn't put their PIN in. So here's your opportunity. If you have questions, please ask.
How do you get, taxes for states?
Any questions out there?
Stupid.
Okay. With that, I think we'll end that. Matt and Deb, thank you very much. We appreciate it. We'll probably do another webinar on their home health care, standalone home health care in the near future, so keep your eyes out for that.
And what's dumb about it...
Thanks, everyone. Have a good weekend.
All right, thanks.
Bye-bye.